The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC, and today I'm talking to Dr. Joao Lima, and Joao is well known to everyone. He's professor of medicine and radiology at Johns Hopkins School of Medicine and the senior author on a very useful paper in JACC that deals with the detection of regional myocardial dysfunction, regional wall motion, and its value in predicting ultimately cardiovascular events in the MESA study, the multi-ethnic study of atherosclerosis. And in this study of asymptomatic patients, they surprisingly found regional myocardial dysfunction, two adjacent segments with reduced wall thickening in 25% of patients, a relatively large number of patients. And in fact, this conveyed a significant increase in the risk, particularly of heart failure, about twofold, but also of overall cardiac events, about 1.5 to 1 3/4 fold. So, Joao, let me ask you, I was kind of surprised that regional myocardial dysfunction was found in 25% of asymptomatic patients. Why do you think that was?
Tony, we agree that the percentage of people who had wall motion abnormalities actually confirmed our initial hypothesis that not only coronary artery disease leads to wall motion abnormalities, but other types of myocardial damage. We didn't have any hints from clinical data, but we did have hints from the fact that these individuals had risk factors, like they were more prone to have hypertension, diabetes, and other cardiovascular risk factors in addition to those for coronary artery disease.
Now, you use very sophisticated MRI techniques. Do you think your findings would be applicable to other imaging modalities like echocardiography?
There has been, Tony, using echocardiography that had similar results, but in a very special population. It was the strong heart study and had analyzed the Pima Indians or similar Indians in the Southwest. Now, and they have a very high incidence of obesity, alcoholism, and diabetes. So the short answer to your question is, I think if you're using an asymptomatic population, more sophisticated methods of strain imaging, for example, will probably be required. If you're using a population with a greater incidence of cardiovascular risk factors, like in the strong study, then ultrasound with just wall motion abnormality caught by eye would probably be sufficient.
So now the take-home message, I guess, Joao, given the fact that you could detect these abnormalities and that they had significant prognostic power in terms of heart failure and cardiovascular events, should imaging be incorporated into the routine screening of patients for heart disease?
I believe that eventually it will be, Tony, because as you know, we are in the large national effort to identify people as early as possible on this continuum towards heart failure, because heart failure is really a major budgetary and morbidity, mortality problem that is growing in the U.S. So I think eventually, as we develop more knowledge about who should be the people screened by imaging, I think eventually imaging will be used, and ultrasound will probably be the modality that we will use for screening folks at risk to develop stage B, stage C heart failure.
Yeah, well, Given the fact that only about 2% of the patients with abnormalities actually developed events, I think probably agreeing with you entirely that we'll probably wait for a really effective and low-cost imaging screening technique. Thanks for being with us. For Inside JACC, I'm Tony DeMaria.